So when we look at employing different therapies for weight loss in patients for a targeted weight loss goal, so for instance, you need to have your hip replaced, or you need to have your knee replaced, or you need to get a kidney transplant, or you need some other therapy where there's a weight target identified. That's different than the person who wakes up on January 1st and says, I think I need to lose 20 pounds, right? These are specific numbers, and we can relate the amount of weight they need to lose to their current weight, and we can compare that to the effectiveness of the types of therapies that we have. This is not different than when you go to the doctor and you have high blood pressure. So you have high blood pressure, your blood pressure's a certain amount over normal, you get a medicine, it gets rechecked, and if one medicine isn't enough or isn't strong enough, you get a different medicine to reach the goal of a normal blood pressure. So we can think of weight management the same way when we're looking at targeted therapy like this. So what are the broad categories then? So we know that a dietary intervention, a good dietary intervention with a behavioral component, I'm going to eat less, I'm going to eat certain times per day, an activity component, I'm going to go to the gym or I'm going to walk, and maybe a support component with a psychologist, in scientific studies is good for about 5% body weight loss. If your body mass index is 40 or 42 or 43, pretty reliably you could get under 40 with that kind of intervention. That's good. If it's 50, probably that's not going to work. 5% isn't enough to get you to 40. But it's always worth trying. The important thing about a dietary intervention when we're talking about a spectrum of weight and a spectrum of therapies is that unlike the high blood pressure, where if your pill's not working, you go back to your doctor, they just give you another pill. In weight management, you have to meet certain requirements to get different therapies. And the majority of those requirements center around an organized diet that's been well tracked. And so if you enter into a medical weight loss regimen for targeted therapy, you want to be sure it meets the criteria for the next step if that becomes necessary. Because the last thing you want to do is put all the effort to go through a diet and make lifestyle changes for 4 or 6 months, and at the end, not be eligible for the next therapy because it wasn't done correctly. So it's really important that we get that box checked, that your insurance requirements are known, and that whatever diet you embark upon meets your goals.